The South Island has its first case of the COVID-19 Delta virus. The case was recorded in Blenheim last night after flying in from Rotorua. It's thought to be linked to the cluster in Te Awamutu. And Northland's new outbreak has grown by 2 cases, bringing the total to 4, all from the same family. Newshub spoke to them today and we'll hear from them shortly. There were 104 new cases today, most in Auckland, a handful in Waikato. And the super city finally hit 90% for first vaccinations. Leighton Hakel begins our coverage from Blenheim.
It was only a matter of time before Delta arrived in the South Island.
Deflated, disappointed, sad for a lot of our local businesses and region.
The infected man got tested because of a sore throat. Both tests returned weak positives. The Ministry of Health says there are only a small number of close contacts who are now isolating, but Blenheim is scrambling.
We're all, in a state now where we want to do everything we can possibly do to get on top of this before there's another outbreak.
While that window is open, testing is key.
Not really any symptoms, just to be sure.
We had the directive from the boss to come down, but we're both feeling fine.
Initial indications suggest the case is linked to the Te Awamutu cluster. What is known is that the infected man flew from Rotorua to Blenheim on Thursday.
That border is one that could be well managed in New Zealand, so I would have thought we should have really a very proactive approach to working out how we can keep the virus out of the South Island for potentially many months till they've got high vaccine coverage.
Interesting to know how the person was able to travel from the Waikato down to here when the Waikato's actually level 3.
High vaccination rates in Marlborough are reassuring. 90% have had their first dose, 78% have had both. It's a different story further south in Christchurch.
I think it's probably going to spread quite fast.
I'm feeling okay and very safe here.
Dunedin has been leading the south in vaccination rates, but this latest case is cause for concern.
That nobody is particularly far away from anybody else in New Zealand. And being in level 2 really is our insurance policy, if you like, and we will eventually be able to do that through higher vaccination rates and vaccine certificates.
The Westland District Mayor says it's a wake-up call.
The question is how far, how fast, and whether we treat things as a one-size-fits-all or whether we're pragmatic and deal with the issues as they arrive.
As Marlborough moves into its peak produce season, the timing couldn't be worse.
It would be a tragic time for Marlborough if we had to change alert levels.
Leighton, are there any locations of interest in Blenheim?
Well, Tom, despite hearing about this case much earlier today, we are still yet to hear if there are any locations of interest here in Blenheim, but that hasn't stopped people going out and getting tested. There are 2 pop-up testing centres, one here in Blenheim, one in Nelson, and tonight the advice remains the same. If you have any symptoms, go and get a test, no matter how small those symptoms might be. And Marlborough Mayor John Leggett is encouraging everyone to go and get vaccinated as well if you haven't already. That's because he wants to avoid any spread in the South Island and wants to avoid any shift in alert levels.
Leighton Hakel in Blenheim, thank you.